The city of Santa Ana is located in Southern California. It is approximately 27.27 square miles with a diverse population. Santa Ana is the second most populated city in Orange County and accounts for 10% of the county's population. 49.7% of Santa Ana are males and 50.3% are female. Santa Ana is one of the 13 cities that make up Orange County. Orange County is one of the most wealthiest counties here in America. In 2014, it had the highest cost of living amongst the Southern California counties. The average annual income per household in Santa Ana is $64,016. In the past 12 months, 19.5% of households in Santa Ana reported being under the national poverty line. 33.2% of single female households reported that in the last 12 months were under the poverty line. The median household income in Orange County in 2011 was reported at $72,293. Poverty can negatively affect the health of an individual in a number of ways. Many harmful health behaviors tend to be more common in people with low incomes. For example, smoking is 1.6 times more likely to be found in adults with low income. Children living in poverty are more likely to have a child as a teen and are more likely to engage in high-risk behaviors, suffer from chronic diseases, and are less likely to have access to health care. Santa Ana has the lowest rate of high school graduates. High school graduates have lower death rates from all causes of heart disease, motor vehicle accidents, death due to homicide, and other health issues. They may also be less likely to engage in behaviors harmful to their health. Those without a high school diploma are approximately 5 times more likely to smoke than those with graduate degrees, and elderly adults are more likely to have insurance than their peers without high school diplomas. Santa Ana not only has the highest unemployment rate in Orange County, but is also higher than the national average. Those whose jobs are lost are more likely to have financial difficulties and are also likely to report poor health, depression, anxiety, insomnia, and other limitations that prevent them from gaining more employment. Santa Ana has one of the higher rates of single-parent homes in Orange County. Children growing up in a single-parent household are more likely to be economically disadvantaged than those in two-parent households. Children in single-parent households also have decreased access to parental time, often causing more stressful environments and lower quality of life. In Orange County, Santa Ana led the county with the highest birth rate. The city's average life expectancy was also lower than the county's average. The leading causes of death in Orange County for men are heart disease, cancer, stroke, accidents, and chronic lower respiratory disease. In women, the top 5 leading causes of death are heart disease, cancer, Alzheimer's, stroke, and chronic lower respiratory disease. Amongst Latino and Hispanic individuals in Orange County, the top 5 leading causes of death are cancer, heart disease, stroke, accidents, and diabetes. In the city of Santa Ana, Only 65.7% of individuals are insured. That is the lowest rate in all of Orange County. Individuals who are insured tend to have better access to health care and therefore have better health than those who do not. For individuals without health insurance, health problems and disease tend to be identified later and they are less likely to receive proper treatment. Children with health insurance are more likely to have a place for regular medical care and are more likely to visit a doctor, ultimately resulting in better care throughout their lives. In central Santa Ana, the area has been designated as a medically underserved area. This designation is given by the Health Resources and Services Administration. It is done so after evaluating the area's access to primary care physician, the area's infant mortality rate, the area's percentage of population living under the poverty level, and percentage of the population that are ages 65 and older. Medical underserved areas lack the tools necessary to properly manage chronic disease, avoid unnecessary costs of hospital admissions, achieve effective preventive health care, and improve on patients' ability to manage serious health conditions. I want to refocus our attention on the community's sexual health. Santa Ana reported having one of the highest rates of teenage birth in the county. Infants born to teenage mothers are at higher risk of experiencing preterm birth, low birth weight, and death in infancy. Children born to teens are more likely to die younger, drop out of high school, enter foster care, use public assistance, and have children as teens themselves. Additionally, teen mothers are more likely to depend on public assistance, live in poverty, and drop out of school. In 2011, Santa Ana had the highest rate of new chlamydia cases in Orange County. Untreated chlamydia infections can cause longer-term health consequences, particularly among women, including chronic pelvic pain, ectopic pregnancies, and infertility. This can occur even in absence of symptoms, making routine screenings important. Chlamydia infection also increases susceptibility of other STDs, including HIV. In 2014, females ages 15 and older accounted for 6,242 new cases of chlamydia countywide. More than half of these cases were Hispanic individuals. Amongst males ages 15 and older accounted for 3,010 new cases of chlamydia countywide. Nearly half of all these cases reported were Hispanic males. Between the years 2009 and 2011, per 100,000 individuals, there were 21 new cases of HIV in Santa Ana. It is estimated that 21% of persons who have HIV do not know that they actually have it. More than 50% of those newly infected with HIV acquire the virus from the individuals who are unaware that they've contracted the disease themselves. Identifying the individuals who are infected with HIV is the most effective way of lowering risk of transmission and receiving actual treatment. Santa Ana reported having the second highest rate of individuals living with HIV in Orange County. The reason why I want to address the sexual health of Santa Ana's community is because this issue can be easily addressed through proper education of sexually transmitted diseases or infections and the proper use of contraceptives. The presented community needs map identifies the three major deficiencies affecting the given area of the city. In northeastern Santa Ana, the three major deficiencies are drug use, child abuse, and teen pregnancy. In central Santa Ana, the deficiencies are lack of medical facilities, homelessness, and alcoholism. Southern Santa Ana, the deficiencies are lack of healthcare professionals, STIs or STDs, along with AIDS, and poverty. Southwestern Santa Ana, deficiencies are high school dropouts, crime, and drug use. And in Western Santa Ana, the deficiencies are teen pregnancy, domestic violence, and welfare dependency. The deficiencies that I've mentioned are not the only ones affecting these areas. Rather, they're the ones that were most reported during the needs assessment for the community. As we can see, 3 of the 5 wards of the city are affected by deficiencies in sexual health, i.e. teen pregnancy, STIs and AIDS, and teen pregnancy again. Now, this map is the community assets of Santa Ana. In northeastern Santa Ana, the assets we have available are local businesses, city library, which is a secondary building block which we can use to establish as a community meeting center. And we also have public capital improvement expenditures. In central Santa Ana, assets we have available are citizen associations, which is a primary building block. That association is Latino Health Access, which is a highly influential community health organization, which I will discuss later on. We also have vacant land and as well as public information in central Santa Ana. In southern Santa Ana, our assets are the individuals who are living currently with HIV. We can utilize them as promotores, which is the method of community education utilized by Latino Health Access. There's also public and charter schools, and as well as public information. In southwestern Santa Ana, our assets are the hospitals and clinics, which are highly valued assets with professional health subject matter experts. We also have parks and association and business associations. In western Santa Ana, our assets are the religious organizations, social service agencies, and public information. The community needs map identifies the problematic aspects of the community, while the community assets map identifies what areas the community will be able to use to implement change, which is important to identify because change can only occur unless the community themselves want to change and are completely involved in the change. One of the greatest assets the city of Santa Ana has is the Latino Health Access Organization, an organization founded by